If you're having shoulder blade pain, you may be wondering what is even back there that's causing this problem in the first place. Today, we're going to discuss what can be causing your shoulder blade pain and give you some ideas of things that you can be doing about it. It's very confusing for people who start to have shoulder blade pain. They don't know what caused it in the first place, because most of the time there's no trauma or anything associated with it. They just went to turn and it all of a sudden started. Or maybe they were even just checking their blind spot and they started to have this shoulder blade pain. Or maybe they were just doing their daily activities and they woke up one morning with it. If that's you, then today we're going to be discussing the structures that could be causing your pain. All right, the first most common structure that can be causing shoulder blade pain is the rhomboids. The rhomboids are a flat muscle and they help to keep the shoulder blades in position where they're supposed to be. This is the most common cause of pain because we tend to put the shoulder blades in the wrong position or tend to sit in more of a slouched position. Now, you may not do this regularly. You may have even really good posture while you're at your desk during the day, but I'm going to encourage you to think about how you're sitting in the evening. I've had many patients who had great posture during the day, stayed active, stayed hydrated, but in the evening when they were watching TV, they were sitting on the couch with their feet up in front of them in more of a slouched position. And this over time is what ended up causing their rhomboid pain. Now, if your pain is coming from your rhomboids, what can be really helpful is to get a racquetball, stand up against the wall, and just do a little self-massage. So you just kind of do little baby squats to kind of massage over that muscle. You'll usually find a spot that's very tender or a knot that you feel like, ooh, that's a really good spot. I recommend working on that spot for about 2 to 3 minutes at a time and then giving yourself a break in between. Loosening up that rhomboid muscle, if it's the problem, can be very helpful. The second most common thing that I see when people have pain in their shoulder blade is a pinched nerve. So in your spine, you have nerves that come out at every level, from C1 to L5, which means in your thoracic spine, which is your rib cage region, you're going to have 12 nerves coming out. You can get a pinched nerve that will refer pain into the shoulder blade. Now, if this is the case for you, you need to find a specialist who can help you identify why that nerve got pinched in the first place. It could be closer to the spine that it's getting pinched. It could be through the muscles as they travel along the ribs. There's different reasons that the pinched nerve can happen, but you need to identify why it's getting pinched or this pain is not going to go away. Now, this one may be a little shocking, but one reason why you can be having shoulder blade pain is because your neck is not moving correctly. This is because there are many muscles that originate in the upper neck that attach into the upper back or the shoulder blade. And many people, if they lose motion in their neck, can start to have pain in that muscle. Most commonly, this will be pain that's along the upper border of the shoulder blade. So this will be at this upper angle right here, most commonly. And people will feel like, I just want to rub that all the time. I just want to put some pressure on that. So if that's you, what you want to be doing is some stretching to get that muscle moving better. Usually it will get tight and bound down, and it just needs a little bit of stretching. Self-massage can also be helpful, and you probably already know how to do it because you know where that painful spot is and you keep wanting to rub on it all during the day. Go for it. It may be helpful if you feel like you can't get enough force on it to use a racquetball standing against the wall to help massage that out for you. One thing I like to do with the racquetball specifically for this muscle is to get it in that right spot. You know, you stand against the wall and you put the racquetball there and you're like, ooh, yeah, that's the right spot. And then I like to move my arm side to side or up or down, and that helps to decrease some of the tension in that muscle. It's a little bit easier to do than just trying to massage it on the wall. The other thing that can be leading to shoulder blade pain is a lack of thoracic mobility, or a lack of mobility through your upper back. So many people get into we call this a kyphotic posture, and stay there for long periods of time. Over time, the ligaments and the muscles stretch out and the joints stop moving correctly. If this has happened to you, and then you try to do something that's overhead where you need to move that shoulder blade more, it can cause pinching and pain. Now, commonly, people will feel it actually while they're doing the activity, but it might also be afterwards that you notice it. If this is you, then what you want to do is focus on getting that upper thoracic spine moving better so that the shoulder blades are able to glide on that rib cage. All right, so there it is. Most commonly, if you're having shoulder blade pain, it's a pinched nerve, it's tension in the rhomboids, it's a lack of neck motion, or it's a lack of upper thoracic motion. Now, to be fair, you could have more than one of these going on, which means each of the tips will be helpful for you on your journey. I definitely encourage you to implement them, give them a shot, go grab a racquetball, do some self-massage, and see if that helps to eliminate your pain. What questions do you have after watching this video, or what have you tried for your shoulder blade pain that helped you? Drop a comment below and let us know what's worked for you or what questions you have. We love making videos to help answer your questions.